And again, thank you so much for stopping to talk to us. I know you've been busy and taking time to go to lunch with us too. We're excited about
Yeah, I'm excited for that part also.
it.
So my name is Nurio. I'm 38 years old. I've been a nurse in Portugal for 17 years, majorly emergency room background. Um, at some point in my life, I decided to, that need a little more fun abroad. So I went to the US. It was in 2015. I was having a lot of fun in the US, but I decided I need to have more fun around the world. So I joined cruise ships. I did a medicine position there as a nurse for 7 years. Decided that I'm having too much fun now and I need some serenity in my life. So I came back to Portugal and, starting to live a peaceful life, growing a family, being a family man. Instead of traveling everywhere in the world. It's just being a family man, and that's why I decided to stay now in Portugal and enjoy the nice time here also.
And what is your title and role here at Serenity?
At Serenity, I am a nurse case manager, actually senior nurse case manager, which is a similar position to, or the most similar position to a nurse practitioner in the US. So we don't have that position in Portugal, okay? Formal position. So we are the closest to a nurse practitioner in the US. And I mean, it's been a great experience to be helping people, saving their lives over a phone or an email, and not saving their lives with my own hands in the hospital setting, but it's really healthcare and helping people the same way. So the values and the importance of the work is there, and it's been great, and Serenity's been great for a lot of expats and people that come from that are not from Portugal, right?
Well, we signed up for Serenity to help us, and we found it very, very helpful. So, can you sort of describe what Serenity does and how it helps people?
Yes, sure. So Serenity is a medical concierge. Okay, it's a team of people that helps other people. Majority it's through a membership base that has nurses that will be assigned to each person, and then we also have our team of doctors. We also have other people helping with the scheduling, the booking team. So it's an ongoing project and a growing project that started in Portugal, and now we have the UK hub and the Spanish hub also in Barcelona. So I think we are figuring out that this is the right path to help people, not only in Portugal but everywhere. So we have the right tools and the right ways to do it, and it's whatever it comes to healthcare needs, whatever the people that they have specific conditions that come to live in a different country, that they are used to have some kind of help, assistance, or healthcare there where they were living, and now here in Portugal we try to do this transition as smooth as possible. So this is our main role, still to help people regardless where they are coming from to Portugal.
Well, and we found that so helpful, of course, when we came in here. And one of the things I think that surprised us was that there is the national healthcare system, but there's also private insurance. I wonder if you could talk a little bit about that, how those two things work, especially from an expat point of view, because we get asked that all the time. How do you get healthcare?
It's okay. Yeah, that's a very common question. So two major systems in Portugal, the private and the public. Okay, so the National Healthcare Service, which is the public sector, I would say it's, when it comes to emergencies, is free for all. As soon as you step on land and you have an issue that needs to be addressed in the emergency room, uh, they don't really care where you come from. They care that you are a human being, and we will take care of you and as a human life. So when it comes to emergencies, anyone can have access to emergencies. Being Portuguese, resident or as a visitor or whatever condition you are in Portugal, they will take care of you as a person. When it comes to the navigating the outpatient services, then there are a little more paperwork per se that it needs to be done. So you have something that is called a UTINT numbers or the SNS number, which is a number that is going to be assigned to you as that will make you be able to navigate the outpatient healthcare service within the public sector. It will bring also other things like state co-payments. The public healthcare system is almost for free or a very small amount charge that can have a cost. When it comes to prescriptions, there is a state co-payment on a very long list of medication that is included. So instead of paying the full amount out of pocket, it's going to be less. And this is, because it's government funded by the taxpayers, that every month people that they are paying their taxes, some part of it goes to the healthcare, and this is what we can provide to the people. When it comes to the private, a little more similar to the US. You have your private insurance. You apply to your private insurance. You will pay a monthly or a 6 monthly or a year fee, and then you will have access to navigate the private sector. Also, even if you don't have insurance, you are able to navigate the private sector. The private sector or goes out of pocket or with a network, and there is a fee for that. I can assure you that the costs are a little less than in the US. We can go a little further.
Actually, I think the costs are dramatically less, as our experience for prescriptions and for the doctor visits. Do you want to speak further about that?
Of course. Medication. I think that Portuguese major difference being working both in US and in Portugal. The major difference is the purpose. So Portuguese purpose on medical is not to make money out of it. Okay, even in the public sector, it's one of the huge holes where the money goes, because they tend to be very tailored for what are your needs. If you go to a doctor will evaluate you, and he's not just going to ask for exams or put you to see specialists if they can take care of things. So it's a little more personalized service instead of, we have GPs that can handle a lot of things. And if you are taking some kind of medication, heart medication, you don't always need to see the cardiologist, because the GP can actually prescribe the medication. So you already understand that is one less appointment or many less appointments with the specialists if the regular doctors can actually address the conditions and the healthcare needs. So when it comes to specialists, I can tell that they will request or they will prescribe an exam that you really need. So it's not like something, standard for everybody at this age, they will need to have this or that. It's more like a tailor-made. So it brings a lot, the exams, the needs, the follow-ups, the visits, way less. But it doesn't mean that it's not the correct way to do it, okay? It's just a different way, less per se economical driven, and more like on a healthcare and helping people driven. This is, it's the way it is.
Curious, we've kind of encountered that the medications aren't exactly the same, but they're very similar. I wonder if you could talk about that a little bit. Is it different companies that create the medicines? Is that why it's slightly different?
Yeah. I can say, exportation and importation will have a major role here. Whoever is producing the medication there in the US, to get exportation or fees and import fees to to Portugal, then we'll have a major role. Then we talk about money, pharmaceuticals, we're talking about money. So there is plenty of companies, plenty of laboratories that produce medication in Europe, even in Portugal. So it tends to, lower the prices for the medication. And also, we have, on the top of this, if the medication is listed, as I mentioned before, that state will co-pay some of this medication, then it's even less. So it will, very small topics here and there will starting reducing the prices of the medication. And again, pharmaceuticals are a major economical based business, although I think it's a little less than in the US. And I'm not saying good or bad, it's just the way it is.
Agreed.
Yeah.
So healthcare for people we've talked to that are interested in possibly moving out of the States, the healthcare is a big, big deal because that's such a stressor for people living in the States. So what advice would you give to someone who's thinking about possibly moving to Portugal, thinking about healthcare, nervous about it? What would your advice be?
Okay. Majorly, I would say to reach out to Serenity. That's the best way. And for sure, we will have plenty of time and people to discuss specific needs. As for sure, for you, it's not going to be the same needs, okay? Many people have different things that they have on ongoing care there, and when they come here, it will just be different. So this is the major thing, is when you come to Portugal, you need to understand that things are going to be a little different, okay? Doesn't mean that they're going to be bad or worse or as ideal, okay? We need to understand that the system has their own assets and their own flaws, and we just need to know how to navigate them, okay? Best advices that I can get on the top of my mind is gather the records before you arrive to Portugal. Okay, medical records, whenever you can, get them before you arrive to Portugal. Okay, I have a lot of clients that encounter difficulties in to get the medical records after they left the country, because they cannot be sent, because there is no fax, because they cannot go into email, because it's a brief on confidentiality and whatsoever. And so I believe that this is the major things. So whenever you come to Portugal, doctors here will read and we will understand exactly the needs, okay? Not like you cannot explain, but it will just support a little more and very thoroughly what you actually need. Then, as soon as possible, I would say get to a private medical insurance, okay? Well, it depends. If you are a billionaire, doesn't really make a difference, okay? Because it's not going to make a big difference. But for the majority, the standard of people that come from the US to Portugal, I do understand that having a private medical insurance will be beneficial, okay? Because there are waiting periods. There are waiting periods for outpatient that takes 90 days, for pre-existing conditions that can take 1 year. So plan things ahead in advance will bring us to a better and smooth process afterward. Also, I would say as soon as possible to take care of the bureaucracy, legalities regarding the residency appointments with the AIMA, residency cards, so you can apply for the as a resident to the SNS, which is the utility number, to navigate the public healthcare system. Even if you think, what, Nurio, we're fine, we don't need to, but it's always good to have, just in case. We never know what tomorrow will bring, so it will always be good to have. And if it's something that is provided to you, being a resident is something that you are entitled to have, good. If you can go to the pharmacy, instead of paying 40 or 50 euros for your medication, you can pay 20. We are already getting, because it's going to be a monthly based. If you are planning to live in Portugal until you are 140 years old, that's going to be good money. And we want you to enjoy the country, and instead of paying 20 or 30 more euros at the pharmacy, get a nice bottle of wine. Portuguese wine is amazing. So and of course, to understand that there are the different processes here, there are major differences, and when we understand the systems a little more, it's going to be much easier and it's not so difficult. I just said this today to one of my clients. It's actually easier than it seems at first. Okay.
Well, anything that's unfamiliar, of course, seems hard and is scary. And I'm interested in your take on this. We've had experience at the pharmacy that's different than the United States. For example, a lot of things you can't just grab off a shelf and run to the cashier and check out. There's more of an interaction. I wondered if you could talk a little bit about that and if you know why it's set up that way.
Yeah, for example, when you go to a pharmacy, the medication that you can pick from the shelf and then take to the counter, they are the over-the-counter medication. Okay, we're talking about cold and flu medication, creams, small anti-inflammatories at some point, some dose. There is plenty of things that you can get over the counter, but when it comes to prescriptions, then it's a little different. You cannot just pick them and take them to the counter. You need to get the prescription, show to the pharmacist. The pharmacist will validate the prescription to understand if you have any questions, if you know the dosage, if the dosage is written is the one that matches what you're taking, if you ever take this medication, what kind of side effects you should expect. So it's a little more personalized service. If, of course, you go for 10 years to the same pharmacy, they already know you and their story, they won't make these questions because they already know you. But at first, they will, understand if you know how to take, what to expect. I mean, it's a little more personalized service. The prescriptions are made and issued by the doctors. Okay, then you keep that prescription and then you go to the pharmacy to get filled. Okay, the pharmacy won't keep your prescriptions. Okay, you keep the prescriptions. Okay, and I for sure know that this would be something that a lot of people ask. So you get your own prescriptions. Imagine you have 6 boxes for 6 months of supplies. You go to the pharmacy, you can take just one box, keep the prescription. In the next month, you go there and you pick up the second box. And the third month, you go there, you pick up the third box, and so forth and so on until the prescription is finished. Okay? When you finish the prescription, you might need a follow up appointment with the doctor to issue a new prescription. Okay? We tend to be not so lenient or so open to issue prescriptions without being seen by the doctor, not renewing prescription just because it was finished. Doctors prescribe the medication a worth on the time that they want to see you again. And this is a major difference from the US practice and the Portuguese practice, because doctors, they do want to understand if the medications are working well, if you are well stabilized with whatever condition you have. If they will say, well, I just want to see you in 1 year time, is everything is smooth, everything is okay, and it will issue prescriptions for a year time. There is no such thing of doctor prescribing you worth of supply of a month worth of supplies, and you expect the doctor will issue another prescription for a couple of months more without being seen. He has his purpose of prescribing you a month worth of supplies. So yeah.
And if I walk into a Portuguese pharmacy and I want a cold medicine, I can't just grab it and go. I engage with the pharmacist. They get it for me. That's a difference. It's not a big deal. It's lovely to engage with them. Is there a reason that
Yeah.
it's like that?
For instance, and being a foreigner coming to Portugal, most likely you don't even know the medication because they are different brand names, as we discussed. Sometimes the dosage are different. And I believe even with Portuguese people, they want to make sure that you're not picking up something that you are allergic to or you cannot take because you have a heart condition or you cannot take because you're diabetic and this medication contains some kind of sugar excipient. So I think that it's more into a care experience more than just like go to a supermarket and get the fruits that you want and pay and go. When it comes to things that can affect your health, uh, they tend to be a little more attentive, okay? And that is the reason the pharmacist will say, have you ever taken this medication? Are you allergic to any of these components? I mean, I say, I'm sorry, I don't even know this brand. I'm brand new here, I don't know. So they will help you to understand what kind of things you are choosing. Okay?
Yeah, that's great. Your first piece of advice was reach out to Serenity to help. And actually, I have to say, I concur with that idea because what we have found is in every different aspect of our lives, healthcare, finding housing, going to the grocery, there are companies and people and services to help. And so I want people to know you're not by yourself, you're not on your own. There are lots of people in all these different areas that are there to help. And Serenity is the one that we chose to help us with our healthcare, and it's been wonderful.
I am very glad that you are reaching out to me to do this because it really helps people to understand a little. Okay, if they are planning to move, even if it's just a brief idea, nothing really structured yet that can help them. When, of course, I agree there is a lot of people that can help in many different subjects. But when it comes to healthcare, and this is what that this was the foundation of Serenity was exactly this. We found a gap in healthcare services and the people's needs when they are not from the country. So we try to fill in this gap and to help and to make sure that the process, because I've been there, I've been on the other way around. The process of moving to a different country, it's difficult. It can be hectic, it can be chaotic, it can be it's uncontrolled because plenty of things depends on the attorneys. It depends on the legalities. So if the major concern for us would be to be healthy or to stay healthy, if we can help with that to alleviate this process, then we are already a step ahead to make the process a little smoother in any other way. Because if you are having a health issue, that will come priority over everything else. So if we already exclude the issues and the major problems when you try to find these on your own, if we can help with that, then you will be free. Your mind will be more open to take care of things that you can't really control. So I'm not saying that we control everything. We try to control. We try to be on the top of everything. Okay, and this is the major point of helping others, is to make sure that they choose my country to live. It's my country. You will consider your country in, for sure, a couple of weeks, months, or whatever, when you feel like this is also your country. And if you come in here, you will contribute on your way. This is the way to do it on the other way, on the opposite way, is to give back to you. So and I'm very pleased that I took this opportunity at Serenity back in the time, because it's been a major difference. People that are joining now or coming to Portugal now than 5 or 10 years ago, they are well more informed and they already know about us and they are still in the US. So it's great to understand that people are putting the effort to have a smooth process and not so much like, let's find out,
Right. Yeah. There are a lot of people trying to help you figure out how to do this and arrive here and be safe and comfortable and set up your life.
Small things, even small things. Even if you go to the hospital and you are there at the desk and the people understand that this is your first time that you are at the desk, and you don't even know what kind of building, floor, what is the elevator, you cannot read, the signs because they're all in Portuguese. And if they will understand And if you have, this is also on you. You, not saying you, but on in general. If you're nice to people, they tend to be extra nice to you. It's like it's not their fault that you don't know how to read the language, the same as it's not your fault that they cannot speak the language, but if you tend to be nice, if you tend to go to the hospital, say, I'm sorry, I don't speak Portuguese, I only speak in English, there is someone that can help me, and you will see, even if they don't speak really good English, they will try to help you, they will try to accommodate, they will say, I don't know how to speak, but they will grab your hand, they will take you to the place, because I think that it's the way culturally that our people act. We were educated this way. I was educated this way, and majority of people that I know are educated this way. And this is beautiful to see towards people that they come to other countries. And when I went to other countries, I also have people helping me there. Okay, culturally, major differences. Okay, but for me, it's really important that our country and our people keep on being this way, because it helps a lot. It will just bring joy. End of the day, at dinner time with the family, I saw two gentlemen, they were so big, but they were so nice. I know, I never seen someone so big, but they were so nice, and I didn't know how to speak with them, but you know what, I took them to whatever they need. This is going to be topic of the conversation at dinner time, guys. Honestly, it's nice, but only, it's not only, but it will work if you are nice to people, if your posture is also nice, if you are, well, I'm sorry, I mean, it's not being, submissive, but it's not reaching there, hey, I need to go here and there. People are like, okay, no, that's the way.
Politeness goes a long way, and that's was our experience at our last doctor's appointment, which I think I messaged you about.
Yeah.
This woman was so extremely nice. There was a language barrier, but she just kind of said, "Follow me. This is how you check in."
There you
And
go.
on top of that, you provided an email that said, "Don't forget these steps while you're there because it's a little
Very
bit
helpful.
different." So,
Yeah.
yeah, we can't emphasize enough what the help is.
Yeah, this is something that we've been working on our first meetings. We talk about standard basics, and then we start narrowing it. Of course, and it's impossible to know everything in one meeting about healthcare, but we start narrowing it. And when people go to the first appointment, they will have this good appointment guide, as we call it. So topics, what to expect, what you should bring, the medical records, the insurance card, your ID document. Because at some point, if you don't know anything of this and you are there at the desk to check in and they will ask you about this and you said, I didn't know, you might find issues. And that is not the purpose in this. The purpose is to start from the beginning, not having issues. Issues will come, guys. They will show up, and we will be here to help, or you will be there to figure it out yourself. But the ones that we already can avoid, why not? And it doesn't take too long. It's just a very small form that you just read, and it's really helpful. Okay, and if you have any questions, you have a number to call, you have your nurse to call, you have people to help, even if you are there, and people will try to help. But always, 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 I always tell this to the clients and to the people that I work to: be nice. That is the way. That is the only way to have these less stressful, smooth, good experiences, things that you can share with the others. No, I went to that hospital, it's amazing. The people there were amazing. And everybody wants to have amazing experiences. So also it's on your part to be nice to people, I think it's a good one. Yeah.
And I've found the Portuguese people to be incredibly kind and patient and wonderful. Culturally, just they all seem to be that way. So bringing them up the way that you are, I appreciate it. It means a lot.
Yeah,
Of course, there is good and bad people everywhere.
Of
Of
course.
course, but the majority, you can understand this is cultural. It's
Yeah.
not luck all the time, you know. You
No.
can't be lucky 100 million times.
Yeah.
It's just something is
Yeah.
it's on our education, on how the things are happening in our lives since we are kids, and I think that's one of the main things that when I travel a lot, when I went through everywhere with the cruise ships, and when I was living in the U.S., this is always something that was in the back of my head. When I go back, I know that I will find my people. And what I want for you is to be part of my people. So bring things that can add Portuguese people nice things also, bring different mentality and a different view of things, perspectives, but embrace this lifestyle, embrace it because it's a very positive one. And believe me, I know a lot of different cultures, I've lived in many different places. I lived in Italy, I lived in Finland, so I lived in the US, and I've spent a lot of time working with many cultures, many different people from different countries, from almost everywhere in the world. And I can tell you that there is, of course, again, nicer, less nice people, but we tend to be nice. So when you come here, be nice also, and you will go with the flow. And by the time you're saying, no, you are more Portuguese than ever. That's when you're gonna be the
I
best.
think that's the best advice. Be nice and be
Be
nice back.
nice, yeah.